All right, welcome everyone. Good evening. My name is Dr. Prakash Patel. I work at TriStar HCA Stonecrest Medical Center. I've been practicing pulmonologist and intensivist since 2006. Welcome to Community Update on COVID vaccine. Thank you everyone who participated and who already joined in. I thank all of our experts in this seminar, all the panel experts. Thank you for TriStar HCA, especially Stonecrest and Skyline Medical Center to make this webinar happen. A special thanks to Carrie Rogers from Stonecrest, Luca Puto, our CEO at Stonecrest, and our division CMO, Dr. Van Decker, for their guidance to make this happen. As you know, we say in HCA, above all else, we are committed to care and improvement of human life. And this seminar is a part of our commitment to our community. And thanks to our panel to join in and help us with this goal. Why we're doing this webinar, the problem of COVID vaccine acceptance are not high. It's only 58% general public said in October that they will take the vaccine. And the reason being they're concerned with side effects. It's a new vaccine. Does it work? Is it safe? How much does it cost? So there are a lot of questions around the vaccine. And our attempt is to address some of the questions and concerns tonight. As a healthcare provider, we can say it's safe. I can show you the proof that we all got vaccinated. And there are some more information, good information tonight from our expert that will help you to make the right decision. Again, even in healthcare worker, there are only 60% acceptance. Some places is 50%. So folks who work in hospital setting, in ICU, day and day in last year or so, they have seen how bad COVID-19 pandemic has been. Despite of that, they have some resistance, they have some difficulty in accepting the vaccination. And their concern is right. And our goal is to do this kind of seminar more and more to address the question and concerns. When you have a vaccine comes up, especially for COVID-19, there's a lot of refusal. Eventually, some folks may say, okay, I'm going to take it, or I'm going to wait and see what happens. And then later on, people will have a more acceptance and they will say, okay, when can I get my vaccine? And they will ask for it. As you all know, millions of people around the world got infected, 93 million in the worldwide. There were 2 million deaths overall in the world. In the USA, 23 million cases of COVID-19, and our death toll is about 400,000. So there's a big number. I mean, nobody has seen this type of pandemic in our lifetime. We all know some of them that got infected, our friends, family, loved one, and we may have someone who lost their life. So this has changed our life. How you can stop the pandemic is basically continue using the mask, social distancing, and eventually get vaccine. And our hope and goal is to get 70–80% of population get vaccinated. And that's really going to be a key factor to end the pandemic. This is, again, I was saying, this is a picture of our TriStar HCA's healthcare worker, Dr. Jayesh Patel, Areli, myself, Dr. Mehta on the left. So we all got vaccinated in last few weeks. We all got 2 vaccines, 2 shots. And, Dr. Patel and Dr. Areli will mention more about what happened and, what are the expected side effects. With that, I'm going to introduce the panel. First one is Dr. Pranav Mehta. He's our TriStar HCA's American Group CMO. Under him, there are 90 hospitals that he's responsible for quality of those hospitals. Before he moved to HCA, he was in North Shore, Long Island, as a vice president of Long Island Jewish Healthcare System. Dr. Mehta is board certified in pediatric internal medicine and clinical informatics. He got his MBA from UT Knoxville. Dr. Mehta is working with HCA and with TriStar HCA. He's been done phenomenal job as far as vaccination planning. That's been going on for months in our system. So welcome, Dr. Mehta. Next speaker, Dr. Jayesh Patel. He's an infectious disease specialist. He's been practicing in Skyline Medical Center and Hendersonville Medical Center for last 28 years. He moved to Nashville in 1993. He's done his training in Nigeria, London, and Chicago. Dr. Patel, Jayesh Patel, has been very active at Skyline Medical Center. He's been board of trustee for many years. He's been leader of infectious disease committee, a lot of publication. Dr. Patel has been also very active in Indian community. He's been president of Indian Association of Nashville, Gujarati Association of Middle Tennessee. He's also involved heavily with senior citizen. He's a board member of Indian Community of Senior Support, and they take care of seniors, provide them food or any kind of need. And he's been very active with taking care of the seniors. So welcome, Dr. Jayesh Patel, to the seminar.
Thank you.
And our youngest member, Dr. Vanisha Areli. She's a pulmonologist and intensivist. She's trained in University of Missouri, Columbia. She's done her internal medicine residency fellowship from Cleveland Clinic. She's done work in Maryland before she moved down to Nashville 3 years ago. Her family lives here. Her parents, her brother lives in Tennessee, in Nashville area. Dr. Areli has been one of the lead physicians at Stonecrest Medical Center throughout the pandemic. She's implemented a lot of different protocols, proning protocols, BAM therapy, convalescent plasma therapy, all the different type of therapy that we can offer to COVID patient. Welcome, Dr. Areli, to the seminar. And with that, let me start with our first presenter, Dr. Mehta.
Thank you, Dr. Patel, and good evening, everyone. Thank you for taking the time on a Saturday evening to join us. I'm going to kick us off with just a macro look at COVID-19 vaccines and, COVID itself, and give you a sense of what's happening, at the national level, and then we'll talk a little bit about what's happening in Tennessee, and, how we should be thinking about vaccines. And so, I'd start this presentation with a question, which is, when supply of vaccine is limited, who should get the vaccine first? And I'll give you the answer in the next few slides. So if you go to the next slide, what you're seeing on your left is, as Dr. Patel mentioned, we're really in the middle of a pandemic, and the numbers we have are staggering. So, 93 million cases worldwide. I mean, that is a huge number. You look at the U.S., we're still in the middle of a pandemic. We're setting records for new cases every day, anywhere from about 200,000 to 230,000 cases. So that's a lot, and it puts a strain on the health systems. Certainly, it's put a strain on us as HCA Healthcare. And then you look at the total number of confirmed cases, 23 million, that's a big number. We're still seeing significant mortality, which means deaths, so about 3,800 just yesterday, and then 400,000 deaths overall with COVID. And our hospitals are full, and they're full not only with patients with COVID, but they're also full with other patients with other medical issues that need to use our healthcare system and our hospitals. So a very difficult situation as we ended 2020. I think 2021 is really, the year we can, really tackle COVID. And I think the vaccine becomes, that intervention that gets us to where we need to go. So what I'm showing you on the right of this slide is how different countries are doing with vaccination. This is a relatively young program, and I think the country that's done the best so far is Israel. And Israel has actually vaccinated within a month about 1 in 4 people in the country, about 25%, which is a big number. You compare that to the U.S., we have 3 per 100. And so really, I think we in the U.S. need to be thinking about how we get vaccines into arms quickly. And I'll try and talk to you about our thinking in terms of vaccine allocation and distribution. So if you go to the next slide, the goal of the whole vaccine program, and if you think about vaccines and you think about COVID, really we started seeing COVID in our hospitals probably in the March timeframe of 2020. And you fast forward to December of 2020, and we really had a COVID vaccine here ready to go. And a lot of this was made possible by Operation Warp Speed, which is, the Trump administration's way of making sure that the vaccine was developed. And we had the vaccine ready by December. And so you think about December, which is just really last month, December 14th was the first day that the vaccine became available. And the first recipient of the vaccine got it on December 14th. There are 2 vaccines that are available so far, the Pfizer vaccine that was approved by the Food and Drug Administration on December 11th. And then a week later, the second vaccine, which was Moderna vaccine, was approved for use on December 18th. So again, as we're thinking about the goals of the program, we want to get everybody vaccinated, right? But having said that, we've got a limited supply of vaccine so far. And so the three goals that we'd like to have in mind is, one, we want to decrease the number of deaths and disease as much as possible. And so what we would call this is mortality and morbidity reduction, and we need to have that. With all of the numbers I shared with you on the prior slide, this is our top priority. Number two, we've got to be able to preserve the functioning of our society. And so then you start thinking about people and the age of the population we take care of. And then finally, it's all about reducing disparities. And so really, how do we think about patients in rural populations? How do we think about minorities? How do we think about people of color? And make sure that everybody has a chance to get the vaccine. So with those goals in mind, if you go to the next slide, there's a committee at the national level called the Advisory Committee on Immunization Practices, or ACIP. That's the body that actually oversees guidelines for vaccines. And so the ACIP committee members, and they're all national members and well-known, for their work, they came together and said, hey, here are three things we need to be thinking about when we think about distribution or allocation of vaccines. Number one, we've got to make sure that it's ethical. So whatever we do, it has to be ethical, it has to be transparent, and so everybody knows how we're actually going to be distributing the vaccine. So that's one. The second principle here is we've got to follow the science. And so there's a really good book of science in terms of the number of patients we've taken care of with COVID-19. As Dr. Patel mentioned, in HCA across our system, we've so far taken care of over 125,000 inpatients with COVID-19. And so we have a really good sense of how we see the pathology, the physiology, some of the clinical findings in patients with COVID and the treatment. And so we've got to think about science. And then finally, once we have the vaccine, how do we get this vaccine out in a pretty efficient manner? So that's really the three sort of principles in terms of how we allocate vaccine. If you go to the next slide, please. We've got two goals that we're trying to balance. One is we've got to be able to reduce or prevent unnecessary complications and death. So that's one. And second, at the same time, we've got to be able to preserve the functioning of our society. And so as we were thinking about vaccine allocation and distribution, sort of those were the two parts of the scale that we had in mind. To go to the next slide. So with those goals in mind, our guiding principle is really about equity, which is how do we really get this vaccine out in a very efficient way? So think about it. The Trump administration had a goal of vaccinating 20 million people by the end of 2020. We ended up vaccinating about 11 million so far. So we're a little bit slow in terms of where we need to be. As the Biden administration comes in, their goal is 100 million vaccines administered in 100 days of the administration. So the numbers there are staggering, and so we've got to have a very efficient distribution channel, and we've given flexibility, and I'll share some of the guidelines at the national level, but then the guidelines really change from state to state. So what we do in Tennessee is different from Texas, is different from Florida, is different from Colorado. And we've given, states and local health departments some flexibility in terms of determining what patient populations they want to vaccinate, again, using an overarching framework. Next slide. So here's the framework, that's used, and this is really the framework from the CDC, which is the Centers for Disease Control and Prevention. It's based out of Atlanta, Georgia. And they're the ones who actually, again, based on everything I said, came up with this phased approach to vaccination with the underlying principle that we've got limited vaccine right now. And with that, how do we start thinking about our patient population? So very easy to understand. It's really three phases, phase 1A, 1B, and 1C. Phase 1A, and I'll just walk through this to give you a sense of how we think about it, is really everybody that's in the healthcare personnel field. So all healthcare personnel workers, they might be paid, they might be unpaid, but they're really in the healthcare settings. and they may be directly or indirectly exposed to patients or infectious material, which is COVID related. So that's the first thing you're going to see. So as you think about who's getting vaccinated, the first phase, or phase 1A, is really all about healthcare workers. And just like Dr. Patel mentioned, I've gotten vaccinated, he's gotten vaccinated, Dr. Patel's gotten vaccinated, Dr. O'Reilly's gotten vaccinated, our nurses, and it's not just doctors and nurses, it's everyone. It's our lab workers, our environmental services, food and nutrition services. So anybody that touches a patient directly or indirectly, we're trying to vaccinate. What's the principle here? We've got to keep them healthy, because otherwise, if they're not healthy and we don't have enough doctors and nurses and healthcare workers, who's going to take care of the patients that are coming into our hospitals? And we already have hospitals that are full. So that's 1A. You drop down to 1B, we're talking about essential frontline workers. And I've given you some examples here of what essential frontline workers mean. So it's anyone from firefighters, first responders, the United States Postal Service. All of those are going to be essential to the functioning of our economy, and we have a duty to vaccinate those individuals. And then also in this 1B bucket is people aged 75 and older. And again, that goes back to the principle of prevention of mortality and morbidity, which is really death and complications. So as you go older, especially 75 and older, you're at the highest risk for complications and death from COVID. And so we really want to get that patient population quickly, and they're in phase 1B. Now, phase 1C is really everybody else, in the sense it's 65 to 74 age, or if you're less than 64 but you've got a medical condition. So what does that mean? You could have anything from diabetes, asthma, high blood pressure, cancer. All of those, would qualify, to get you a vaccine in phase 1C. And then you've got all other essential workers, like information technology would be a great call out, where we want them to be vaccinated as well. And that really is more about preserving, kind of the societal function. So again, this is a very high level view of how we think about vaccinating. And it's a very methodical way to vaccinate based on the number of vaccines we've got available. Go to the next slide. The next slide again shows you the same thing with the goals in mind and the principles in mind in really category 1, A, B, and C. And we're, again, if you look at Tennessee, we're trying to work our way down from 1A to 1B and now into 1C. And really, I think what you're starting to see with the CDC guidelines is they really want everybody 65 and older to be vaccinated. And then if you're less than 65, they're going to push for vaccinating those that actually have a high-risk medical condition. Next slide. And this is an enormous undertaking. And what I'm showing you here is just the data in a little bit of a different cut, which is the number of people we need to vaccinate. And that's huge. So you look at the 16 to 64 bucket, that's about 110 million people. 65 to 74, another 32 million. 75 plus, 21 million. And then, you go beyond, 1C, you're talking another 86 million. So again, I think we've got a lot of work ahead of us. I think we're making every attempt to accelerate, vaccination and getting vaccines in the arms. And it's really going to be a partnership with the local health departments, with the state governments, and then the federal government. Next slide. And so, for all of you, on this WebEx with us, where do you get more information? Certainly in Tennessee, go to tn.gov/health. And there you'll actually find a really nice tile, which is COVID-19 vaccine information. You can click on that, and it really gives you lots of good information in terms of the COVID-19 vaccine. And then if you go to the next slide, I think, really if you need additional information, you can always get it from the CDC, the Centers for Disease Control. They have a really nice section under coronavirus, and there's plenty of good information on the COVID-19 vaccine. So with that, I will turn it back over to Dr. Patel, and we'll take questions at the end of the presentation. Thank you.
Thank you, Dr. Mehta. If you guys can hang on, we're going to add our next presenter, Dr. O'Reilly.
Good evening, everyone. While Dr. Patel is getting it loaded up, I just want to thank everyone for joining us. We really appreciate it. I'm going to just talk about background, basically, of COVID-19 and the vaccine distribution, and as far as production, and why Moderna's and Pfizer's and AstraZeneca's vaccines were so amazing, kind of the process that came about. So I'm sure everyone is used to seeing the same image of COVID-19, but the things I want to focus on here are really the spike protein at the very top of this image, and then the mRNA, which is essentially the part of the virus that allows it to have its own data or instruction manual. The spike protein allows it to attach to our cells. And I'm going to go into why this is important in just a minute. So in the next slide, you can see, it's coming up. This is a really good schematic of how COVID-19 essentially attaches to our cells. You can see in the top left corner, there's the image again that we just showed. The middle top corner, the top middle corner basically shows the top middle image shows it attaching to the cell. And then on the right-hand side, you can see it injecting the mRNA into our cells. When that happens, there's a whole host of and constellation of things that take place as far as making more protein, more mRNA, more COVID-19, and then how it basically leaves the cells. So this is how it enters our cells. Once it is in our body, these are the main things that gets affected besides a combination of things we're about to go into. The ones that we're more critical or more concerned about for a majority of our patients is the respiratory failure when it enters into the lungs. It can also cause havoc in our epithelial cells of our blood vessels, basically in our blood vessels, leading to this high state of clotting and leading to a lot of clots within the body. And the last thing, which is a combination of everything, is this overwhelming inflammatory response of the body, where the body is just churning out tons of different cells and different inflammatory markers, and it's basically an unchecked storm within the body. Next slide. And we're going to focus a little bit on what happens in the lungs. If you can take the lungs and you magnify them and you magnify all the way to the main unit of the lungs called the alveoli, which is one of the singular units that helps with breathing. It's a very thin unit, and it basically allows air to come in, oxygen come in, it's into the blood vessels, and carbon dioxide goes out. So when COVID-19 comes, it obviously causes this big chain of events where there's an influx of a bunch of cells that come in. And these cells are, again, causing that cascade of events where you're starting to see more cells come in and more cells come in. So in the next slide, you can see what happens in the later stages when there is this huge influx of cells. This is not helping the lungs because now we're filling in those individual units with fluid, cells, and then it's eventually leading to damage to the blood vessels, leading to clots. All of this is the main reason our patients cannot breathe when they get to a more moderate to severe stage of COVID-19. In the next slide, you can see kind of the schematic that we see on a CAT scan. So this is a chest CT, and we're looking at basically the slices of the chest. The white part is bone, the black part is air. The two large structures that you see kind of going from image to image are the lungs, and the middle part is the heart. Generally, those two structures should basically be black. But you can start to see this white patchy stuff that starts to form in A and progresses to B through C. And the other kind of screen that you can see, the CAT scan, is shown in D, E, and F. So it progresses to basically filling in the lungs with, again, fluid and cells and other types of more inflammatory markers. The next slide will show, besides the lungs, there's a whole havoc and a whole constellation of effects that occurs to the different organ systems, including the brain, the kidneys, the liver, the GI system, again, clots anywhere, the cardiac system, even the endocrine. This is like diabetes and high blood sugars and skin. So COVID-19 can essentially manifest itself almost anywhere in the body. That's okay. We'll go to the next slide. So the next slide kind of highlights the vaccine productions that we have seen. And there have been a lot of different companies who are producing the vaccine. The one that's highlighted here is the one that is the main vaccine we're using in America, which is Moderna's and Pfizer's. And they're using something called a nucleic acid vaccine, which basically means that they are injected and they are created to have the mRNA of the vaccine, of the virus. So the mRNA, again, is the instruction manual. So essentially, these vaccines are giving ourselves the instruction manual of how to identify COVID-19 when it comes into our body, and then how to defend itself, and then how to destroy it. None of these vaccines have any, the ones that are in America, have any of the virus within them. These are just components of them. The next slide is the, AstraZeneca's vaccine. You can go to the next slide and it'll pop up in the red box here. And that's the viral vector. And again, that's the spike protein that we showed earlier. And that's the part that attaches to the cell. So in AstraZeneca's vaccine, it's basically allowing your cells to recognize the spike protein, allowing our cells to be able to defend and destroy the virus before it even attaches to our cells. So if we go to the next slide, now we can kind of understand a little bit more about generally how vaccines are developed, approved, and manufactured. And this is a very complicated amount of information. So I'm going to try to synthesize it in very simple and very succinct ways. So basically, there's normally three phases, and each phase has an increase in volunteers. Phase 1 is a small group of people. Is it safe? Does it work? Are there any side effects? If everything's okay, you go to phase 2, you increase the amount of volunteers with the same questions, and you go to phase 3, and you increase to hundreds or thousands of volunteers. This is generally how all vaccines and most medications are actually created and go through the FDA process in America. In the next slide, you'll see that the FDA did something specific for these vaccines called Fast Track. And it's something that has been in place with the FDA. This is not a new concept for the FDA, where basically they expedite the review process. And they're using this for drugs that are used to treat serious conditions and fill medical need. This is not the first time. We did this with anthrax. We did this with H1N1. This is not the first time we fast-tracked medications through. So the Pfizer vaccine, you can see they combined certain phases and they were able to have less of a delay. Moderna also was able to be granted a fast-track designation in phase 2. And AstraZeneca combined phases 1 and 2. Phase 3 had a little bit of a hiccup, but then it was reviewed by independent reviewers. So each company was allowed to basically have a fast-track process to be able to get through the actual development phase. So this on the left-hand side, you can see that's this is generally how vaccines have gone through the FDA system. And on the right-hand side, these are the vaccines that have been created for COVID-19. So as you can see, comparing both of them, they have been, all of the vaccines for Moderna's and Pfizer's, they have gone through every single process that all vaccines normally do, but they have just been able to shorten and combine certain phases. The next slide. So let's talk a little bit about how Pfizer's was so effective. And efficacy basically means how well does this work? So among the thousands of participants that were enrolled in this trial, they had very few actually, when they were inoculated with the actual vaccine, had any symptoms or signs of COVID-19. Placebo means that some participants received normal saline and some participants received the actual vaccine. Each participant didn't know who was receiving what. So in the placebo with the normal saline, 162 participants had mild to moderate or severe versions of COVID-19. Among the participants who received the vaccine, only 8 had exhibited any symptoms, and these were mild to moderate. In the next slide, you can see the actual safety outcomes, meaning what are the side effects that patients or participants are having. And again, this is looking at ages of basically 16 to 55 on the left and above 55 on the right. And you can see here that among the placebo compared to the vaccine, the biggest issue was the pain at the injection site. Otherwise, there's a little bit more fatigue and headache. But even those who received the placebo, some of them had fatigue and headaches even without the vaccine. The next slide, and that was Pfizer's. So in the next slide, we'll be able to see how this is Moderna's vaccine. So Moderna had very similar side effects also: fatigue, aches in your joints, in your muscles, headaches or chills. And the top part of this, where the numbers are there, that is the actual percentages of participants who had side effects to the vaccine compared to the placebo. And you can see that even again in placebo, some people had similar side effects, but these are the main ones that they saw. So this slide, I think, is a really nice comparison slide. It compares the shingles vaccine compared to the Pfizer vaccine, compared to the flu, compared to placebo. And again, the biggest complaints that participants had, or biggest side effects, was local pain, fatigue, headache, and some aches and pains. And if you compare that to the flu or to the shingles vaccine, these are very comparable events that people have had. The COVID vaccine didn't have any new side effects that were not exhibited in other types of vaccines that have already been given. So the next slide is basically showing that because all of this was appropriately done and the FDA was able to give a fast track designation so that different companies combine certain phases, the FDA again did the last part of this, which was allow for emergency use authorization. And they can essentially, during a declared emergency, make a judgment to release something, a medical device, medication, with having enough initial information to say this is effective and it's safe. And again, this is not the first time that the FDA has done this also. So this is kind of the process of how we are able to get the vaccine so quickly. It's not that we sidestepped or overstepped any of the phases. We're able to combine things and still make sure that the safety profile was reviewed and there were no untoward outcomes that were unexpected. So this is why it's green, because the FDA basically stated the Pfizer's and Moderna's are good to go in America. And again, other countries are using other types of vaccines. Like in the UK, they have allowed for AstraZeneca's, and in India, they're using AstraZeneca's. So all these vaccines are in this phases now where they're being distributed to the public, as Dr. Mehta discussed earlier. So thank you.
Thank you, Dr. Rayleigh. We'll have the question answer session at the end, so please make sure you have your question marked, and also you can message us the question. I would like to welcome our next presenter, Dr. Jayesh Patel. Give us a second when we change the screen here. Jayesh bhai, you got the screen?
Okay. Can you all hear me then? Okay, good.
There you go. You want to take over?
All right. So, well, thank you, Prakash bhai, Dr. Patel. I've done a couple of talks in small groups about the vaccine. So when Dr. Patel said he would like to also do another talk for a larger group, I was very happy to join in because it's a very important topic. I'm very passionate about vaccines, and especially the COVID vaccine, because of the problems I see in our community at the hospital. I've never seen anything like this. I've lost a family member to this disease, and I'll do everything possible to help educate people so that they don't get this disease. So I am actually going to present a little bit different way. You know, Dr. Rayleigh has done an excellent presentation about the vaccine, but sometimes when you do a lecture format, people hear, but they often forget. So I'm going to repeat a lot of the things she said, but in a different format, in a question answer. So as I walk around the hospital, a lot of people are asking me questions about the vaccine. So I have kept some of those questions in my mind, and I'm going to try and answer them for all of you today. So I'm going to open my slideshow.
Do the share, just by share. One. There you go. You got it.
All right. And everybody can see, right?
Yes, we're good.
Okay. So today I'm going to talk about COVID-19 vaccines in a question and answer format. All right. So Dr. Rayleigh mentioned some of this, but it's a common question. And for people who joined in the meeting late, I'll repeat some of this. So what are the common vaccine side effects is one of the commonest questions that I'm asked. So pain and soreness at the injection site, headache, body aches, muscle pain, joint pains, tiredness, fever, and chills are the common side effects. But as Dr. Rayleigh said, these are common side effects of many vaccines, and actually the common shingles vaccine that a lot of elderly people have been taking enthusiastically because nobody wants to get the shingles. They've heard of bad, problems with the shingles. Well, this vaccine actually has similar or less side effects than the shingles vaccine. So I'm hoping this message gets through to the people who are worried. And what are the side effects? The side effects are actually not the virus damaging you. It's not like something's burning you when you get in front of a fire, but this is actually your own immune system. When it recognizes this vaccine from the outside your body, it thinks something is invading it and that it's going to kill it. And it develops immune system cells and chemicals. And it's these chemicals that your body produces that cause the side effects, that cause aches and pains and fever. So it's your own body's immune system. So it's nothing to be worried about. It's something that we can all live through. Also, We also found out that when we get remember, these vaccines that have been released so far, you require 2 doses. And what we also found out during the studies is that when you get your second dose of the vaccine, you're more likely to have this kind of side effects. And maybe instead of a mild headache with the first time, you might get a moderate headache, right? So, and why is this? Because your body has already been trained by the first vaccine in how to make chemicals to kill this so-called virus, which is not really a virus. Right now, it's just a mimic virus, the vaccine. So it's already built up a lot of defenses. So next time it gets the vaccine, it says, aha, I recognize this thing and I'm ready for it, and starts releasing all these chemicals to kill it. So that's collateral damage, and that is what all the side effects are. So nothing to be worried about. If you are planning to take a vaccine and you're worried and you do plan to have a full day's job, 12-hour shift, doing something very serious, you might want to schedule your vaccine at some other time, maybe when you're about to take a day or 2 off. And most of these side effects happen for a couple of days, starting the day after the vaccine. The day of the vaccine itself, most people don't have that much, but it's the second day and the third day if you're going to have the side effects, and then they go away. So again, Dr. Ali mentioned this, but to repeat and to help you understand again, what is an mRNA vaccine? So mRNA is in all living things, bacteria, humans, animals. So mRNA is a genetic molecule that gives instructions to the cell machinery to make a particular kind of protein. So we all have it. And so does this COVID virus. So in the COVID-19 vaccine, they have included this mRNA message that tells our human cells to make the virus spike protein. That's the one that you saw in that picture, because we have found that the spike protein that attaches to our cells to help it enter our cells, that if you can deactivate the spike protein, then the virus is no longer able to enter our cell and cause disease. So that's why they chose this in producing these vaccines, for the coding of the spike protein. So our immune system recognizes new spike protein that is made by your cells because of the vaccine mRNA telling your cell to make this protein. Our body recognizes that this shouldn't be here, it's foreign. And so the body builds an immune response to get rid of it. Also, this mRNA does not last in our cells. It is a very fragile molecule, and our body gets rid of this molecule in a short period after its job is done. So it doesn't hang around. So another one very common question, a lot of fear, because a lot of bad things on the social media. So one of the common questions and concerns is, will the COVID vaccine alter my DNA? Because I heard this word called mRNA, and that, it talks, that's scary stuff, talking about genes and things like that. But the answer is no. COVID-19 mRNA vaccines do not change or interact with the DNA in any way. The mRNA from the COVID-19 vaccine never enters the nucleus of the cell where our DNA is kept. So this means the mRNA cannot affect or interact with our DNA in any way. So feel safe. It's not going to mutate you. Well, it's not just me. Everybody wants to know who's going to pay for this vaccine. Well, thank goodness, to encourage you to get it, it's not you. The government has decided that this is such an important thing. They don't want to leave it to people to decide for financial reasons whether to take it or not. Because even if people don't take the vaccine, this pandemic will continue unabated. Many more people will die. So it is a national emergency. So the government has said they are going to pay for it, directly or indirectly, but at least not you. So vaccine doses purchased, the US taxpayer dollars will be given at no cost to you. However, if I'm the physician providing the vaccine, I'm able to charge for it, but the money won't come from you. So the vaccine provider can get the fee reimbursed by the patient's insurance company, or if you're uninsured, then the government will provide fund to pay the person that's administering the vaccine to you. If I already had the COVID-19 disease, do I still need to get the vaccine? So that's a common question among my colleagues, because a lot of my colleagues, unfortunately, nurses and other people at work have been exposed to COVID-19 patients, despite their efforts to try and prevent getting infection, because they are so heavily exposed. And many of us already had the disease. So the common question asked is, do I still need the vaccine? So my advice, I don't know, there's a message coming across here. I'm not sure what that is.
Okay.
It's still showing up on my side. Anyway, I hope you can still see me and hear me. So so our advice is that even if you had the COVID-19 disease, you should still get the vaccine. We have found that people who had COVID before still have come down the disease later. Not too many, but they are coming down, and we would like to do everything possible for them not to get reinfected. But the other side, I just recovered from the disease. Do I still need to take the vaccine? How long can I wait? So if you're hesitant or you would like to wait, it's okay to wait up to 90 days after you came down with the disease, because we have found out from experience that people who have COVID-19, they usually don't get a second case within the first 90 days. So if you like to wait up to 90 days, it's okay. But if you like to get it after you recover at any point in time, it's perfectly fine too. Okay, now I'm stuck. Something has happened.
Just click on the,
Okay, there we go.
Good now.
Going backward. There we go. So one of the other questions is, does the immunity from the disease last longer than the immunity provided by the vaccine? And the answer is, we don't know at this time, because the vaccine is new. Even the disease has not been around for that long. So the correct scientific answer is we don't know. The CDC is, of course, collecting all this data, and when the correct and the right amount of information is available, we will all be informed about how long this vaccine immunity will last. One of the other common questions, again, I work along with a lot of nurses who are my good friends, and they are concerned because many of them are of an age where they may want to become pregnant or are already pregnant during this pandemic. So the questions are, COVID-19 vaccines safe for pregnancy? So first of all, I cannot give a perfect scientific answer based on firm data, but there are some things we can say. So the vaccines were not studied in people who are pregnant. So if you are pregnant, you are not allowed to enter the study because a new vaccine, they're still trying to gather data and they don't want to expose people unnecessarily in the beginning. So we did not have firm data. Some people did become pregnant, however, after they got their first dose of the vaccine, and they continued to get the vaccine, finish it, and they did not seem to have any adverse outcome. But there were a limited number of people, so we cannot give you firm answers. However, what we do know is that pregnant women who contract coronavirus and get COVID-19 face a much higher chance of being admitted to the hospital compared to non-pregnant people, and also have a higher chance of being admitted to the intensive care unit, and they'll come on a ventilator or even dying. So we should do everything possible in addition, like wearing masks, social distancing, and also maybe considering taking the vaccine, even if you're planning to become pregnant or are pregnant. So again, for reassurance, mRNA vaccines are quickly broken down and degraded in the body. They are not live vaccines. They don't enter the nucleus of the fetus cell, because many people are worried not just about themselves, but the baby. But it does not enter the fetus cell and does not alter the mother's or fetus's baby's DNA. Okay, so don't worry, your baby is not going to become malformed or anything else like that from genetic mutation of the baby's DNA. The American College of Obstetrician Gynecologists has also said the vaccine should not be withheld from people who are lactating. Lactating means are you breastfeeding? So even if you're breastfeeding or pregnant, they say you should not withhold the vaccine. And if you're able to get the vaccine, go ahead and get it. Also, the college says that the vaccine is not believed to cause infertility, miscarriage, newborn harm, or harm to a pregnant person. We have to use the word believed, but again, because it's not been enough people who have had this vaccine while pregnant to say firmly. But, putting everything together with experience with previous vaccines that are live, it is a, common sense statement to make. So women who are trying to conceive should feel comfortable with the decision to get the vaccine. And if they should conceive after the first dose, they should go on and get their second dose and complete the full series to protect themselves fully. Another common question: if I'm vaccinated against COVID-19, can I still spread the virus to other people? So again, we don't have the answer at this point. The vaccine trials did not look at the vaccine's ability to prevent virus transmission. The trials only look at the vaccine's ability to prevent disease, which the trials showed successfully that the vaccines did prevent disease. But do they prevent transmission? We don't know. And that data is being collected. However, personally, and I highlight that personally, this is my feeling, is that I feel the vaccines will reduce virus production if you're infected because of the immune system, trying to control the virus. So if you have less virus, you're less likely to transmit that virus to other people. And therefore, I believe that there will be reduction in transmission if enough people are vaccinated. Is everyone able to get the vaccine? Who should not get the vaccine, right? There's always pros and cons of everything. So these vaccines were studied only in older people. They were not studied in children yet. So we cannot say it's safe for them to get it or to help them. So the Pfizer vaccine, they studied at age 16 and over. So if you're a 17-year-old, you can get the Pfizer vaccine. However, it is not advised yet for a 17-year-old to get the Moderna vaccine because they only included people above the age of 18. Now they're studying younger people too. But this is how the FDA approved the vaccine based on the data that was submitted. More data will be submitted later, and we are hoping that younger people will be able to take advantage of either of these vaccines and any other vaccine that is released in the future. As with other vaccines, anyone who has a fever, you're currently sick, we advise you shouldn't get the vaccine right now. Get better, heal, and then go get your vaccine. Have your immune system in full, gear, ready, so that it can respond to the vaccine. There's also caution for people with documented anaphylactic reaction to vaccines. So for the lay people, what is anaphylaxis? So anaphylaxis is a serious condition that happens after you eat something. It could be food or inhale something, or you take a pill medication or an injection. Then your body within a few to several minutes has a response where you may have blood pressure may fall, you may go into shock, your throat may swell up, you may have breathing difficulty. That's what's anaphylaxis. So people who have had this kind of reactions to vaccines in the past, right now it is advised that perhaps they shouldn't take the vaccine, but I'll talk more about that later. Also, if look at the components, if you have serious allergy anaphylaxis, you should know what you'll be allergic to. You can go on the website and find out what the different ingredients of this vaccine and whether you should take the vaccine or not. So how about other allergies? Not anaphylaxis, but less serious allergies. So can I get the vaccine if I have allergies? So the answer is yes. So if you have allergies to pollen, some other medications and things that's of mild nature, food allergies, does not exclude you from getting the COVID-19 vaccine. You can still get it, and you should. Individuals who have had severe reactions like anaphylaxis to the injectable medication or vaccine in the past, again, are advised not to get the vaccine at this time. However, there's always a however. If such an individual is at high risk for acquiring COVID-19, suppose you're an ER physician or an ICU physician or a respiratory therapist that has to intubate people, get close in their face, you're at very high risk for getting exposed. And suppose that same person is also 65 years old, has hypertension, diabetes, and kidney disease. If they were to acquire this infection, then there's a very high chance of having a serious complication, including ending up on a ventilator or even dying. So for such people, it makes sense for them that they may want to take the vaccine and should be offered to them and it should be provided to them. But those people who have serious anaphylactic reaction and they still wish to take the vaccine, they should take added precautions. So they should have the vaccine under good supervision. Certainly, they should not go to a drive-in place that's providing vaccine. They should go to a good healthcare setting where emergency aid can be provided rapidly and by the right people if you were to get anaphylaxis from this vaccine, which is, again, is very rare. Only, handful of cases have been reported so far. But, again, we don't want to take anything lightly. The other thing I advise for people who have serious reactions is don't get your vaccine in the evening or on a weekend when there are less people around to help. So one of the advice I give to my colleagues is who have these concerns is go like on on a Tuesday or Wednesday morning when all the people are, working, nobody, less like been on vacation, full staff, everybody's got full energy and ready to react if you have a problem. So that's some common sense advice for you if you choose to take the vaccine, even if you have a history of anaphylaxis in the past. How about, can I take another vaccine along with the COVID-19 vaccine? So suppose, this is flu season. I say, I want to get a flu vaccine, I want my COVID-19 vaccine. So what is the advice for you? You should wait for 2 weeks after taking another vaccine before taking COVID-19 vaccine. So let your immune system, finish doing its job, get rested and be ready for the next vaccine. So if you took the flu vaccine last week, don't take the COVID vaccine this week. Wait another week, wait for 2 weeks. And conversely, if you had your COVID-19 vaccine, wait 2 weeks after completing your series before taking any other vaccine, whether pneumonia vaccine, shingles vaccine, flu vaccine, or any other vaccine. So 2 weeks before or 2 weeks after is the general advice. So how will I know which COVID-19 vaccine I received? So you have the two different vaccines right now, right? So you all know about Moderna and you know about the BNT Pfizer vaccine. So when you go for your vaccine, you will receive a vaccination card or printout that tells you which COVID-19 vaccine you received, when you received it, and where you received it. Keep this card in a secure place. You may need it in the future. Okay, so you should also receive a paper or electronic version of a fact sheet that tells you more about the specific COVID-19 vaccine you are being offered. So make sure you get this fact sheet. If you have any questions, ask the person administering the vaccine. So all people who get the COVID-19 vaccine should be monitored on site. Don't leave right away in case you have a reaction. So if you have never had any severe reaction to any food or any medication or any vaccination, then 15 minutes is usually adequate. However, if you had a serious reaction to something else in the past, then we advise you should hang around for 30 minutes before leaving the premises. So this is a photo of the card you should be receiving. It tells you, they will write down the lot number. So if there's a recall or any other issues, problems, then at least you'll be notified and you will know whether you need to be vaccinated. Highly unlikely, but everything should be in order. The date and who gave the vaccine will all be signed. You bring your card the next time you come, so that gets on there. You never know when you may need this card. When you're traveling, you want to go on that cruise that you haven't taken for a long time. You want to travel international, you're not going to India to meet your parents. You may need a lot of this information down the road to be able to get onto that plane or to go to that meeting or go on that cruise. So how long does it take for the COVID-19 vaccine to work? So unlike a Tylenol or something you take for a headache, which works within a few minutes, vaccines don't work that fast. They take time for the immune system to be trained and be ready to fight. So, and that's common with all vaccines. What we do know about these particular vaccines, both the Moderna and the Pfizer vaccines, is that in the studies, they found out that protection from the vaccine started about 10 to 14 days after the first vaccine was administered, the first dose, and the protection continued to increase with time. And we believe that full protection is achieved about a week or two after you get your second dose of the vaccine. So another comment, what are the difference between the two vaccines? So, well, one, we talked about the age earlier. So Pfizer vaccine approved for age 16 and over, the Moderna for age 18 and over. The vaccination schedule is slightly different. So Pfizer studied their vaccine to give the second dose around 21 days, 3 weeks. So if you want to schedule your second dose, try to schedule between 17 and 21 days after the first vaccine. Now, other intervals may work just as well or even better or less so, but we don't know because it's studied that way. Okay, so try to stick with the schedule because that's the way it was studied and proven to be effective. So Moderna vaccine, the second dose usually 24 to 28 days after. So schedule your second dose 24 to 20 days after your first dose. The other thing is storage, not too important to you. This is more for the people who are supplying and distributing the vaccines. The Pfizer vaccine is stored at a much colder temperature, minus 94 degrees. and the Moderna vaccine at a much more easily achievable -4 degrees Fahrenheit. Those are different. The Pfizer vaccine is a 30 microgram dose of mRNA vaccine, and the volume injected is very tiny, 0.3 ml. Hardly feel it. When I got the vaccine, I didn't even feel anything expanding in my muscle like you usually do when you get a shot. It's that tiny. And the Moderna vaccine is also a tiny 0.5 ml, half an ml, but the dose of the mRNA they use is 100 micrograms of their vaccine. What does this mean between the difference between two doses? Nobody knows, because nobody has compared the two vaccines side by side in a trial. So it's just information, but nothing that we can take from here. And they're both similarly effective at 2 months, okay? Now, I do not know what the effectiveness will be 6 months from now. Which one will be better? I think that's when we'll actually be able to tell if one vaccine is better than the other. Right now, I don't know which vaccine is better. They are equally good, 95, 94% effective. That's really not any difference whatsoever. So one of the other things, when can I stop wearing a mask and stop the social distancing thing that's keeping me away from my family, friends, my vacation, my restaurants? Unfortunately, there's not enough information currently available to say when the city will stop recommending that people wear the masks and avoid close contact with others to help prevent the spread of the virus that causes this disease. So experts need to understand more about the protection that the vaccine provides. If it only protects you for 2 to 3 months, that's not good enough. So we need to have longer-term data that they're collecting. And we are hoping also that enough people have become immune either to disease or from the vaccine. Then the CDC may say, okay, it's all right for you under certain or most circumstances not to wear a mask or to do social distancing. But right now is not the time. We should do all of the above. What can you do to improve your layer of protection here? This is something I scratched up earlier this afternoon. So this is what I'm calling layers of protection. Okay, this is you in the middle. You have been vaccinated. You are partially protected, not fully protected, because we know the vaccine doesn't work for everybody and we don't know for how long. However, if the people you socialize with regularly, if they have also been vaccinated, then the chance that you will get COVID from them becomes much less. Additionally, if you encourage all the people you socialize with and tell them that they should ask their social circle also to get vaccinated, then if that peripheral circle doesn't get COVID, they're less likely to give it to the person who, and then that person will come. So that the risk becomes infinitesimally small. So when enough of that kind of vaccination happen, then you can get together again in small to medium groups. And unless you're at a very high risk, like a 90-year-old with diabetes, high blood pressure, you can start relaxing sooner than later. So try to get all the people around you vaccinated as soon as they can and tell them to get the people around you. And you can start relaxing and get together again in groups with less fear. Another one, mutations. So how long will this vaccine be effective? We heard about all these mutations, the UK strain, the South African strain, the Brazil strain, and many others. There's a Texas strain, American strain. So some of these strains have been found to be much more contagious. They're spreading much faster. And we believe that's going to keep driving this pandemic instead of slowing down and going away. So, but do we know if this vaccine will work for these new strains? So my answer is I believe they will, based on what I've heard from other experts. Do we have data? No, because the mutations are recent and they were not included in the trials. But let me tell you why. Because there are multiple sites on the spike protein that our immune system recognizes to develop immunity after vaccination. And if there's a change to one part of the spike protein, the mutation, there are still other targets on the spike protein for immune system to attack. And not all mutations affect the spike protein. They may affect other parts of the virus that have no effect whatsoever on the vaccine. And it is our belief that it likely require many mutations to significantly reduce the effectiveness of the current vaccine. And that may take many months or a few years for the vaccine not to be effective, by which time, hopefully, we can modify the vaccine if necessary, if the coronavirus is still around, as we believe it still will be. So which vaccine is better? I talked about that earlier. The answer is we don't know. We'll know later which vaccine provides the best long-term immunity. So right now, my advice to you is you should take the first vaccine that's available to you and start vaccine-induced protection as soon as possible. Don't wait for your favorite company or thing that you heard on the internet. So these are the what are the different CDC vaccine groups. I'm not going to talk too much about that because Dr. Mehta has already discussed in detail. And again, the two main important things in the beginning, they're focusing on the people who are most likely to get infected, the healthcare workers, and the people are most likely to have serious consequences and die. And those are the long-term facility, those are nursing home and long-term facility residents. Actually, about a third of all the people that have died in the United States belong to that group. So that's why they're focusing on that group right now. How about Tennessee? So this is what was the expectation as of end of December, by which groups will get vaccine and when. That's a common question. When will I get my vaccine? So right now in December, they start with the healthcare workers. And now in January 2021, they're adding the elderly. And then they're going to go to 65 and above, and childcare staff, first responders, and then as time goes on, more vaccines available, they'll go to different groups. If you want to take a photo of any of the slides, I wish I had told you earlier, and you could have taken pictures from your camera. So because some of these things will fly overhead or we forget, I wish you had, but what's happening is some of the counties where we provide the vaccine, some of the initial group of people have not taken the vaccine. So, it may be available to other people earlier than we thought. So, common question, how do I get my COVID-19 vaccine? So for Tennessee, take a photo now if you like, if you haven't already done so and registered. Register on the Tennessee.gov website, and that in red is the actual address, URL. Let's take a photo, but you really don't have to. Actually, even if you just do Google, it will show up, it will take you there. Also, if you have any questions, you need to understand better, here are the hotlines. So for the people in Davidson County, 615-627-7777. The Williamson County number is there, and the surrounding Nashville surrounding counties. The hotline is 866-442-5301. Then also Williamson County people can also use that number. So these are the current phases in the beginning. So many of you young people who are not critical care workers, healthcare workers, you probably won't qualify right now, but go to the website, try and register, see what happens. And then they'll send instructions later on when you qualify and get more further information from you. But if you have any questions, call those hotline numbers. So again, this is the Williamson County, this is where I live. And the process they have here is, you go to the SurveyMonkey, you fill in the information, and then later on they send you information for the Sign Up Genius if you qualify to get the vaccine. And then you'll be given a date when you show up for the vaccine. So here are my summary statements from my talk. So, other people already told you, around almost 400,000 people as of January 16th have died, despite the best hospital care in the world here in the United States. And at this time, over 3,000 people are dying daily from this disease. In Tennessee, we have had over 665,000 cases as of today, with over 8,000 people dying from this disease. So my message is get your immunization as soon as you can, especially if you're a healthcare worker or in a high-risk group, and increase your protection as soon as possible. Do not make your vaccine decisions from social media messages. Listen to experts who work in this field and get your information from reliable websites such as the CDC, Mayo Clinic, WebMD, New York Times, FamilyDoctor.org, and many others. Find out from your friends and family or your doctor which reliable sites they recommend. Find your information from those sites. So for my healthcare worker colleagues, healthcare workers and individuals who provide care to the elderly should get the vaccine, not just to protect themselves, but also so they do not get sick and infect the people they're supposed to be caring for. I'm going to repeat this message. It's very important. I want to recognize and thank all my colleagues, doctors, nurses, respiratory therapists, and other hospital staff who have already taken the vaccine for doing the right thing to protect themselves, and indirectly, they're protecting everyone around them. I also noticed there are many hospital staff who have not yet taken the vaccine, mostly because of fear instilled in them by social media posts. Let me tell you, most of the information that scares you is fake. Look at the real data on repeated sites. Do not be afraid. Do not bring shame on yourselves from your colleagues, family members, and friends by not listening to the bona fide experts and not taking the vaccine to protect yourself and others around you, including your patients. So I appeal to doctors, nurses, and other healthcare workers who have not yet been vaccinated to get vaccinated now, unless you have a serious allergy to any of the components of the vaccine. Your actions will give the confidence for all others around you to take the vaccines to protect themselves. They look up to you. Now is not the time to sit on the fence. Thank you. And that's the end of my talk, Prakash Bhai. Dr. Patel.
Excellent presentation, Jayesh Bhai. Thank you very much. Very strong message. Very strong message. So we have a lot of question came, and also thank you, Dr. O'Reilly and Dr. Mehta. So I'm going to pick question and pick one of the expert and see if we can address that. Let me see. The first one came from Priyanka Sharma. Priyanka, say hi to Chander Sharma, my buddy. How is the primary care PCPs involved in distribution or administration of vaccine to the patient? This question goes to Dr. Mehta. How is the primary care involved? Currently, it is very cumbersome to get it via state health department. So any thoughts on that?
Yeah, I think a great question. I think one, be patient. Two, as Dr. Patel said, check, your counties or Williamson County in terms of, when you can get your vaccine. Reach out to your PCP office. I think currently we have limited supply of vaccine. And so depending on where you get your primary care and what system, whether it's Vanderbilt or HCA or Ascension, call them. Because we're slowly trying to move from the inpatient side and healthcare workers to the community, again, following CDC guidelines. So I think it will become available, but right now we're just trying to balance the priorities.
And one more thoughts on that. All the health departments are different. Like if you go to Williamson, Davidson, we have a lot of healthcare providers. So the health department are not there as far as getting more and more vaccine. If you go to peripheral, if you live in a smaller town, those counties may have earlier access for you. You just have to call every week, check online every week. Some health department may have a standby vaccination. So they have let's say, for example, 100 vaccine open for 75-year people. They're not able to get all done that day, and they may have on-call list. So a lot of different things are going on. So you just have to be active, proactive, and check with them every week.
Yes, call that number and get advice. Keep calling.
Yeah. So next question for Dr. O'Reilly from Tarun Surdi. Thank you, Tarun Bhai. What are the organs can be affected with virus? I think you covered, Vanisha, but if you can repeat that, summarize that. Let me hold on. Unmute you. Yes. Let me unmute you. How about now? Go ahead, Vanisha.
Yep. That's actually a very good question. I think the ones that we are seeing a majority of compared to the other organs are the lungs, the vascular system, including blood vessels, the heart, and the kidneys are kind of the primary ones that we're seeing a lot of, but it can affect a lot of the organs in different ways. And unfortunately, we don't have a really good answer because the data is still coming in because it's such a novel virus. So we are getting this by case reports, meaning a physician has seen a patient with this specific manifestation of the virus and affected the organ in this way. And then that's how we're getting the information. We have seen, unfortunately, the young who are healthy, who have gotten a very bad version of this in their lungs where it fills them up, they go on a ventilator, or they have something called cardiomyopathy where their heart balloons out. and essentially go into heart failure very early. And the clotting cascade, the process that leads to the clots is still a little unclear as to why that's actually happening, but we're seeing that can affect essentially any organ at that point. So it can pretty much affect any part of the body. And it is something that I'm humbled with every time I walk into the ICU, into the hospital, because I sincerely feel that COVID-19 treats every person different. One person will have the lungs, one person will have the kidneys, one person will have the neurological where they're confused, somebody will have a combination. And it's very hard to be able to appreciate that unless you see it firsthand basis. And it ranges from age and from gender. It doesn't really pick a specific type of manifestation in this group of patients who are older or in men or women. It really is different from person to person. And that is the danger of this virus, is that it really does not discriminate, and it does not give a prediction to us as physicians for us to be able to appreciate how bad this virus is going to be in this person. We've unfortunately intubated 22-year-olds, and we have had 65-year-olds who survived. So it's a wide range and a wide combination of things that can go wrong in the body.
I'll also like to add to that. So Skyline is a stroke center. And as Dr. Ali mentioned, the blood vessels, the coagulation is affected, and blood vessels go everywhere, get clotting everywhere. And one of the common ways how strokes happen is by clotting or blocking of the blood vessel. So that's one of the very common presentations, actually. And so when people come with a stroke, now we are testing them for the coronavirus. It's not just the typical things we used to think about, people having coughs, runny nose, shortness of breath. It can present in almost every different way to different people. So, we are testing almost everybody that enters the hospital for any reason other than falling down and having a fracture.
Okay. Thank you, Jazbai and Dr. Ali. Also want to add that we also seeing people getting blood clot 2 months later. You had a COVID infection 2 months ago, and then you come back with significant amount of blood clot in the lungs. Also affecting lung function. People are getting lung scarring or fibrosis. So again, COVID affects any organ, and it could cause significant damage. The next question from Tammy Larson. She used to be our OR nurse at Stonecrest, and she and her husband, Dr. Jeff Larson, surgeon, they moved to Alaska a long time ago. They wanted to live in the cold area. So thanks for the question, Tammy. When is it safe to associate with people who have recovered from COVID infection? Dr. Jaiswal, when is it safe to associate?
Yeah, so, the CDC was very conservative in the beginning. As they got more data, they kept changing and allowing a little bit more liberal. And so there are two main things. So generally speaking, 2 weeks is plenty. So for the average person that did not end up in an intensive care unit for a long time, usually we do not feel that they'll be contagious after 2 weeks. Although for the most part, most people, even 7 to 10 days, the infectivity goes much less. The CDC gave the longer number 2 weeks before, but they realized that many people cannot stick to 2 weeks. It's difficult. So they were not even sticking to 5 days because they're just not going to do 2 weeks. I'm going to do 5 days just to go out and, start infecting the people. So they have come down to a smaller number that most people 7 to 10 days, which will, be good enough for 99% of people. But if I had the COVID, I don't think I'll visit a 90-year-old patient for 2 weeks. Okay, now if I'm surrounded by young, healthy people, 7 to 10 days is plenty to be in isolation.
Okay, thank you, Joseph. The next question for Dr. Mehta: if I get my first dose in Alaska, again from Tammy, if I get my first dose in Alaska, when it becomes available, can I get my second dose in Tennessee? Is the state allows it? Do you have any idea on that? If you're traveling.
I think this is going to be it depends, type of answer, because I think generally what we would prefer is that, you get the second dose generally of the same vaccine. So, and you get it really from the place you got your first dose from. And so if you're coming to Tennessee, again, I would say it just depends. If we have the vaccine and, you fall into the criteria, we could try and get you vaccinated. But with limited supply or inventory, I think it's going to be a little bit difficult. And I don't know, Jayeshbha, if you have
So
any
yeah, so
other
let me
thoughts.
expand on that. You're correct, but let me expand. So there are different situations. So rather than depends, you must get the same type of vaccine. There are different vaccines. So we do not recommend just for ease or sake of ease that you take the different vaccine the next time. You must get the same vaccine. Make sure you keep your card. That will be useful for you to request your second dose. They will take that into account and to try to keep you on time. There's a follow-up question and answer. So what about people that got sick or had something else? They couldn't get the second dose. Does that mean they can't get the second dose? It's beyond that 3 weeks or 4 weeks? No. You can still get your second dose as late as it is. Doesn't matter. It's 2 months, 3 months. We believe there'll still be a good booster effect. So try and get your second dose whenever you can, even if it's late. But very important, get the same vaccine for your second dose. Don't mix up another vaccine.
Thank you, Jasbhai. The next question from Priyanka, again, this for Dr. O'Reilly. What is major reason of low adoption rate of vaccine in Tennessee? And I think we show some numbers, 60%, 50%. Wondering what is causing folks to decline. Any thoughts on that, Manisha?
I think a lot of it is unfortunately misinformation that was distributed very early on. And this was not just from the vaccine, but from the virus itself. When it first started making its way to the shores of our country, the public received a lot of misinformation. And there was definitely not a uniform approach from multitude of medical societies to step forward and state what they thought was happening. This is because this vaccine, the virus came so quickly, so fast, and so furiously that we were literally getting information in bits and pieces from China, from Italy, from Washington State, from New York City, and we were trying to all put that information together about what does the virus do. So unfortunately, it came out as piecemeal information to the public. And I think because that happened, and we were not aligned early on with as medical societies, and that is something that we should be able to take part in admitting that we did not do as well. That is where the misinformation of the vaccine proceeded with that or followed up with that. So I think because of that and the distrust of the public, because there was so much misinformation coming through and the medical societies didn't come together, that we are behind in basically educating everyone. And I don't blame the public for having this opinion because it did come across as very scattered. But this is unfortunately the scientific experiment, the way we do experiments in science, the public was watching it live. This is essentially what we do in the world of science. We have a theory, we test it, and we get evidence. The only difference was that because of social media and obviously great, wonderfully that the press was involved, you were seeing it live with us. We were doing the studies with all of you watching it. You were seeing the studies failing and some studies that were not failing, succeeding. So you were witnessing the scientific method along with us. And I think part of that led to some people to not trust it because they thought, well, this didn't work, so why should I trust the next thing? But this is how we work in science. We try something, it doesn't work, we try the next thing based on the theory and the evidence. So I think that is where a lot of the distrust came. But unfortunately, we got behind. But now I feel like all the medical societies have gotten together. We have more information. And I think that's where I'm hoping as we continue to do like we are doing tonight, I'm sure there's a lot of other providers who are doing the same in different cities and different states to try to make sure that in their community, they're letting them know that we are here for you and we're here to take care of you. We're not talking about some remote provider from New York talking about what's happening. We're talking about what's happening here in Middle Tennessee. So we are all with you and we're working with you to help make things better. And I'm hoping that is what's really going to change the tide. And I think Tennessee is catching up with that at this point.
Yeah, let me expand on that. I think that the main thing I'm hearing from the nurses, especially, and my doctor colleagues and other people close to me on the technical, the social media posts has been a very determining, driving factor. The other thing is the political situation. it looks like this virus has declared as, it's nothing. It's going to go away tomorrow. I'm strong. Nothing's going to happen to me. Young people don't need to worry. But, even if young people, most of them don't get sick enough, they can spread it to somebody else who dies because of them. This continue the message has not been effective. So the message from above has been, not properly given. In this new funding that's coming out, billions of dollars, the message is going to get billions of dollars to get the message across to people so they understand. The other thing is the information that's coming bits and pieces is getting the people too early, out of context when it comes out in the news. Somebody gets anaphylaxis in London, all of a sudden the news is here. Well, somebody dies in Florida after a vaccine, the news is all over the world, but it's totally out of context. Millions of doses of vaccines in United Kingdom, Russia, America, and other places, China, have been given millions of doses. So you've been exposed to millions of doses, and a handful of people have had serious reactions, a handful. A lot of people have had aches and pains and headache, no question. But only a handful of people have got a serious reaction out of millions. How about when millions of people actually got the virus? When millions of people catch the virus, hundreds of thousands get ill, thousands get admitted, and thousands die. That has not happened with the vaccine. So the context has not been explained properly. So the social media that disseminates this out of context and the news media that delivers it does not always provide the full context. And that's our duty. And hopefully this kind of sessions that we are providing can help provide that kind of context. And I'm hoping, the funding will help give this kind of information to people who need it.
Thank you, Jayesh. Strong message. The WebEx was up to 7:30, but we're going to continue. Hopefully it won't fall off. And the next question is, let's see, from Miss Rekha Sindal. Vaccine is good for how long? Like how long the effect of vaccine? Jayesh, you can speak for it.
Yeah, so I think that was one of the slides I had. So the answer is we don't know. Because this vaccine is a new vaccine. It has been proven to be effective for 2 months because that was their first data point they had to provide to get this vaccine approved. Does it work at 2 months? Because we want to get this vaccine out, start protecting people now. And will it protect me 6 months from now or 1 year from now? We don't know. So they're looking at different things. They're looking at the antibody levels. How fast are they falling? They're looking at people who have been vaccinated early during the trials and see if they're coming down with COVID. And they're monitoring all that. And once that information is available, we will know. But right now, the answer is we don't know. But don't let that be the decision maker whether they're going to take the vaccine or not.
Thank you, Jayesh. The next question, I think this was also in your last slide. Can vaccinated person infect other person who are not vaccinated?
So, so the answer is no, not with the current vaccines that we have. Okay. Now, the measles vaccine that people take is a live virus vaccine. Mm-hmm. And the chickenpox vaccine is a live virus vaccine. So your body actually has a minor infection. And in some cases, some of the virus escapes and it can infect other people, especially the weakened immune system. But as Dr. Areli led you to the beginning of her slideshow, this is not a live vaccine. This is a component of vaccine that cannot reproduce itself. And you cannot, I wish it was. I wish I could get vaccinated from my friend who got the vaccine. I could go get the vaccine. But no such luck. I'm not going to get coronavirus. I'm not going to be able to get the benefit of the vaccine from somebody else.
Okay. The next question for Dr. Mehta, what will be the role of HCA with respect to distribution and administration of vaccine to patients here in Nashville-Brentwood region? She's talking about patients.
Sure, I think great question. And so, I think we're committed to vaccinating all of our patients within the HCA healthcare system. And so I think as more vaccine becomes available, as we have more inventory, we're going to not only try and offer the vaccine, through our hospitals, which really is not the best way to offer vaccines in a community setting, but, we will be working actively with our clinics to see if we can move some of the vaccination over in the clinic setting. So, more to come, and please do stay in touch, and we will communicate that out proactively when, patients are ready to receive vaccination.
Thank you. And I think we did have discussion on that about if you're admitted and you already had a first vaccine. So I think we are discussing it at HCA, TriStar to get you second vaccine if you had a first vaccine. So I think there is some movement on that. The next question for Dr. Rayleigh, any new data if the spread via air or surface or both? How does the virus COVID-19 spreads?
It's not any new data. It's the same that you're basically, it's from transmission of droplets, and it's an airborne virus. So this is why when patients are in the hospital, we put them in something called negative pressure, which is a very fancy way of saying that it just basically ejects all the air out of the room. So those are patients who are highest risk of causing the virus to be transmitted with the high chance of it coming from their mouth or their nose into the air. Those are patients usually intubated or on some types of oxygen called high flow or BiPAP, and all these things can cause it to transmit more. So it is still the same information. I know there's a lot of different studies that are coming out showing how long it survives on different surfaces, how long it would survive on metal versus cardboard boxes. And those were all very definitely interesting studies, and it was useful for us, but it hasn't changed the information that we've received that, again, this can travel in the air. This is why we're wearing masks, to prevent ourselves, if we're infected, from basically not ejecting those particles in the air by us wearing a mask, and then also social distancing for that purpose. So this is similar to when you think about TB. Similar concept. This is the same kind of things that we did with TB when it was more causing more disease in America. Same kind of quarantine, same kind of concept. When the flu first came out in the 1918s, like with the Spanish flu, this was the same kind of concept. We were basically wearing masks, and the flu transmits differently than COVID-19, granted, but it's the same still kind of thought process. So I know there's a lot of different studies that's coming out, and as Dr. Patel's mentioned, there's lots that come through social media. I also get little blurbs about it, and it's interesting, but doesn't change that what we've always said: hand hygiene, mask, social distancing. It is the simplest of solutions to a more very complex and dangerous virus.
Thank you.
Just a small comment to that. So it's mostly through the air. A combination of droplet and aerosols that stay in the air for a long time. And but also eye protection, at least in the healthcare setting, has been shown to be useful also, not just a mask. So for people, and a lot of people in the healthcare field, where you have to be close up to somebody, also eyewear is very important, because our eyes are connected to our nose through ducts, and then of course to our lungs. The other thing, I want people to become proactive. So we are talking about masks. So the masks do protect you, but they don't protect you that well. We need additional social distancing also. That doesn't protect by itself. So multiple things. Be proactive. The people that are around you, shame them. Tell them to wear a mask also. Because if they wear a mask and they have COVID-19, you are much less likely to get it, even if you don't wear a mask. So the person who has the virus, if they're wearing a mask, that's the biggest benefit of them wearing the mask, not spreading to others. However, if everybody's wearing a mask, this pandemic can be very quickly arrested and brought under control. But we have chosen not to follow the guidelines. Please pass on this message. Be proactive.
Thank you. Thank you, Jasbhai. And the next question is from Ralpesh Patel. Thank you, Ralpesh Bhai, Jaswaminar. For Jasbhai, I have seen several people who wear a face shield without a face mask. Just only facial. Is this effective protection?
This is totally not effective.
Okay.
Maybe mine, I won't use the word totally, but I would like to be very strong on that. No, because as Dr. Ali mentioned, this is also airborne. So yes, a lot of it is droplet. That means cough, and within a few feet, those droplets fall, and a lot of the virus falls down with the droplet. So if you have that shield, yes, it does protect you. But what you also find is that the smaller droplets, the tiny droplets, they hang around in the air for a long time. And as you breathe, as the air is swirling around, it's bringing those droplets from the other outside, and you're inhaling that. So it should not be acceptable. Okay, unless somebody has some kind of condition where they can't wear a mask, a health condition, then for them, of course, that is better than nothing. But that should not be acceptable.
Okay, thank you, Jasbhai. Let me ask this for Dr. Really. What about this question is from Ms. Vasudev. What about immunocompromised patient? How long does their immunity last? Do they have same side effect on vaccine? I guess vaccination on immunocompromised patients.
Sure. There actually were some patients who were immunocompromised who were enrolled in both Moderna and Pfizer studies. I haven't had a chance to review AstraZeneca's data in as detail, but there were not that many, but there were a few. Some of methotrexate, which is a common medication that we use in different types of rheumatological conditions or lung conditions. And those patients actually did fairly okay. There weren't any detrimental side effects. In fact, what we're recommending and encouraging is those patients who are immunocompromised, who are at great risk. Those are the ones that we want to capture, make sure to vaccinate early because their immune system is not intact from the disease, and their immune system is also targeted from the medications they're taking. So they're highest risk of getting COVID-19 and having a lot of the actual detrimental damage to the body. So those are the patients we're actually encouraging to get the vaccines. And so far, people who have gotten the vaccine who are immunocompromised, the data, again, is still kind of trickling in from that. We haven't seen any bad effects for those specific group of people.
Yeah, just to add to that. So absolutely, the people who are at high risk are the immunocompromised, the elderly, so we encourage them to take the vaccine. The other part of the question was how effective is for them. So we don't know yet, that data is coming. We have to assume, based on our experience with other vaccines, that it may not be as effective in immunocompromised persons, as for people who have a healthy immune system that can build a good immune response. So while we encourage, and if I were a caretaker of I insist that they take the vaccine, they should continue to take additional preventive measures like masking and social distancing, even after getting the vaccine, more so than other people, because the benefit of the vaccine may not be as great. But please take the vaccine.
Okay, thank you, Jasbhai. The next question from Venkat Reddy. When you are getting your first dose, are you able to book second dose appointment? I see currently health department are booked up for a few weeks already. Pranabhai, any thoughts on like if health department are able to give 2 shots schedule?
I think, and again, I'll say it just depends on vaccine inventory. But what we're hearing from, the federal government is if you have the ability to give the first dose of vaccine, they will make sure that we get enough inventory for the second dose. So, my recommendation again is Jayeshbhai said, we need vaccine in the arms. The federal government will make sure that there's enough vaccine inventory coming. There might be some delay, but our goal is to get everybody the 2 shots that is recommended.
Okay, thank you. Next question is from Jack Patel. He signed up his parents 2 weeks ago, but have not heard from anyone in Davidson County. Any update? Do you know, Jayeshbhai, if Davidson County is still at 75 age, or are they opened up?
Yes, they've not gone any below that yet.
Okay.
From what I know. We'll keep trying, call them on the hotline. It's been a long time just to make sure that registration was valid and complete and still active.
Okay. Let me go through the next question. Is understand COVID? Okay, I guess this is all just thanking all the presentation.
Very good.
All right, I think we are, anybody else has any question? Let me, one more thing, Jayeshbhai, if I have a control, I want to show one video and then we can take any more question if people have it. Can I have the control, Jayeshbhai?
Oh, sorry. Yeah.
Just.
I think I released it, didn't I, earlier?
Oh, you did? Okay.
Yeah.
Let's see if I can go to my screen here. Yeah, I got it. Thank you. I have one video for everybody before we end the evening. If you guys can hang on a few more minutes. If I can open the video. Again, it is just encourage everybody for vaccination. Almost loaded.
The United States is turning the tide on the pandemic, and it's starting with healthcare workers right here in Tennessee. Welcome to News 2 at 10. I'm Bob Mueller. The Pfizer vaccine is making its rounds through hospitals across America, and dozens of frontline workers lined up at TriStar Health today to get their shots. News 2's Chelsea Boncourt was there as doctors and nurses received the long-awaited vaccine.
A historic day here at TriStar Centennial Medical Center, where dozens of healthcare workers on the front lines of COVID-19 received the first vaccines, and hundreds more are scheduled to in the coming days. TriStar healthcare workers greeted by applause today as they entered the room to receive their COVID-19 vaccinations.
There's such a sense of excitement. We've moved from passively dealing with this pandemic to actively fighting back.
About a dozen doctors and nurses entered the room at a time, each sitting at a socially distanced booth to receive their shot. An HCA healthcare rep tells News 2 TriStar received nearly 3,000 vials of the Pfizer vaccine in this first round of distribution.
It really was less painful than a flu shot.
I've been waiting this for a long time. I got the vaccine. Didn't hurt one bit.
TriStar infectious disease doctor Jayesh Patel says after months of watching patients end up on ventilators, he was eager to take the vaccine and hopes others will be too.
Historically speaking, all the big contagious diseases that used to disable and kill so many people, like smallpox, polio, measles, they are either eradicated or controlled by vaccines.
Health experts estimate that 70 to 80% of the population will need to be vaccinated for life to return to normal. Critical care nurse Christine Lunger says the vaccine has given her a glimmer of hope.
We know it's not going to be immediate, but there is a time frame that this is going to be coming to an end.
Been waiting for this day to get something like this that can help me, my family, my patients. There's no question I'll remember this day forever.
This Pfizer vaccine does come in two parts. So those healthcare workers that received the vaccination today will receive the second dose in 3 weeks. Reporting in Nashville, Chelsea Boncourt, News 2.
And today's vaccine recipients are doctors and nurses from all 7 Middle Tennessee TriStar locations.
All right, guys, this is, I think, let me make sure we don't have any more questions before we end the night. Let me see. All right, there may be a last question. Let's see, about asymptomatic patient. Jayesh, maybe you can handle this. What steps do they need to take after a few weeks or months? Asymptomatic patients. Any impact on their health if they never had any symptom, but they were positive, COVID positive?
Yeah, so unlikely, other than what you mentioned earlier, some people are coming with blood clots and things later on, but not having initial symptoms such as cough and fever. But otherwise, no, I think they have mostly escaped the worst part of the disease. Even if they had the asymptomatic virus, make sure you get your vaccine. And again, an appeal to the audience that joined us today. Thank you. We are doing this not for ourselves, but for you. Make sure you spread this message to your friends, to your colleagues. Make sure that they get protected also, not just you who have listened to this message.
All right. Thank you, everybody. Thank you, Jayesh Patel, Dr. Redley, Dr. Mehta, our speaker. And thank you, everybody, for participating. Hopefully, you got some information. You are more motivated and more excited about getting vaccine when your time comes. And if we all work together, I think there is an end at the site. Maybe this summer or maybe months down the road, I think we can beat the pandemic. Thank you all. Jayesh, any last word?
No, thank you all. Actually, and thank you for arranging this. This is my passion, and thank you for helping me and helping all the other participants to get this message to more people.
Manisha, last word.
I just want to thank Dr. Prakash Patel for organizing this event. It definitely is not easy to do, being an intensivist also, and making sure we're all ready and available to do this. So I did want to thank him for doing this. And I want to say just one thing, that we are your community physicians, but we're also in your community. I mean, we are speaking as people who are wives, daughters, sisters, friends. I mean, I have told my parents to get the vaccine. I've gotten it. I'm ready for when it's available for my husband to get it. So we're talking the talk and walking the walk. We're in your community, And we are advocating for you to do something that we believe is safe for our bodies and our own loved ones' bodies. So everyone keeps asking, how are we going to get back to normal? This is a beginning step on the road to normalcy, to get back to normal. And as everyone continues to get more information and to ask the right questions, we are happy to answer them at any point. Feel free to reach out to us in any way possible. Talk to your providers, talk to your friends who've gotten the vaccine, and make sure to, educate yourself about this and to make sure that you feel comfortable. It is your body and it is definitely your choice of what you want to do. But we hope that we help guide you in that process and that we hope we help you to make the choices that benefit you and your health, as we always do as physicians. So again, we are all in this together, and we thank you for your time tonight. We appreciate it.
Thank you, Dr. Riley. Dr. Mehta, are you still on?
Yeah, I'm still on. I would just say thank you, and thank you for giving us an opportunity, to serve you back. I think this is a way we can give back to our community. So I'd say thanks to all, and we're here to help and support you. Thank you.
Okay. Thank you, everyone, and have a good night. Bye-bye.
Good night, all.
Bye.
Bye.